Mast Cell Activation Syndrome is a condition that affects more people than you might think. Some reports estimate that 1 in 6 people may have some form of mast cell disease, with MCAS being the most common. Despite this, it's often misunderstood and can be challenging to diagnose. To really understand MCAS, it's crucial to first understand what mast cells are and how they function. Mast cells are a type of white blood cell that play a key role in your immune system. Think of them as the security guards of your body, always on alert for potential threats like allergens, infections, or toxins. When they detect a threat, mast cells release chemicals like histamine to protect the body. This release of chemicals is a normal and essential part of your immune response, helping to fight off harmful invaders. In people with MCAS, these mast cells are hypersensitive. They overreact and release chemicals far too often or in response to things that shouldn't be considered a threat. This causes an inappropriate and exaggerated immune response, which leads to what we call a mast cell flare-up. During a flare-up, your body essentially goes into overdrive. It's almost like your body is stuck in fight or flight mode, constantly perceiving danger when there is none. The mast cells release a flood of chemicals, which can cause widespread inflammation and a variety of symptoms. You can think of it like your body's alarm system going off unnecessarily, putting your entire system on high alert. These flare-ups can trigger a wide range of symptoms. You might experience skin reactions such as hives, flushing, or itching. Digestive issues like bloating, nausea, or diarrhea can also occur. Respiratory problems such as shortness of breath or wheezing are common, as well as cardiovascular symptoms like rapid heart rate or low blood pressure. Neurological symptoms like brain fog, headaches, or even anxiety are often seen too. What makes MCAS so difficult to diagnose and manage is that these symptoms can vary widely from person to person. Mast cells are found throughout the body, which is why MCAS can affect multiple systems at once. No two people experience the condition the exact same way. Some might have mild occasional symptoms, while others may deal with severe chronic flare-ups that significantly impact their quality of life. This variability in symptoms makes it hard to pinpoint the exact cause or to identify clear patterns, which is why it's often misdiagnosed or overlooked. Now let's talk about what the centralized healthcare system commonly assumes is the cause of MCAS. The mainstream medical perspective is that MCAS is the result of a dysregulated immune system, and usually attributed to a person's genetic predisposition. In other words, the assumption is that if you have certain genes, you're more likely to develop MCAS. However, when you dig deeper and keep asking why, they don't fully explain why this dysregulation occurs. They typically stop at the idea that your immune system is dysregulated, probably because of your genes. The focus is then placed on treating symptoms with medications, but the underlying question of why your immune system is behaving that way isn't explored. In reality, there are many variables at play, and it's not just about the genes themselves. The way your genes express themselves is arguably a much larger factor than the genes alone. This concept is known as gene expression, and is influenced by your environment, things like lifestyle, diet, and stress levels, and your mindset. In future videos, I'll dive deeper into my own hypothesis on the true root cause of MCAS. I believe that by addressing how our genes express themselves through changes in our environment and mindset, then we can take significant steps towards managing and even reversing our symptoms. There's so much more to this story than genes, and I'm excited to guide you through it.